Hi, everyone. Thank you. Welcome to Dr. Pam's segment. This is where we learn, we educate each other about disease processes and how we can manage them well. So today I am talking about Crohn's disease, and Crohn's disease affects the colon. It affects the colon. It's an chronic recurrence of immune response inflammation that involve the discontinuous segment of the GI from the mouth to the anus. So Crohn's disease involves as soon as you start eating, swallowing, all the way the GI system, all the way to the time you poop. That is, it affects that route. And usually people have inflammation on that route. So there is a big difference between Crohn's disease and ulcerative colitis, which I'll talk about next time. So when you have Crohn's disease, usually you have a lot of diarrhea. Sometimes you can have diarrhea and a few episodes of not having diarrhea. And it can occur at any age. You can be okay, and then all of a sudden you start having Crohn's disease where you have episodes of diarrhea, and it is very frustrating. Most of the patients get very, very frustrated. So sometimes it is you can have constipation. After the constipation, then you will have diarrhea. You have diarrhea after the constipation. It is just like interchanging. So one time you have diarrhea, one time you have constipation. It's very frustrating, as I said. Most of the people have colic pain. Like when somebody is a child, they have all that abdominal pain. Those are the signs of symptom. Abdominal pain. There's usually passing gas. People pass gas a lot of the time. People lose weight because of the diarrhea. People lose a lot of weight. There's fatigue, tiredness, and anorexic. People look like sickly. They can't gain weight because when you're having diarrhea, you're losing a lot of nutrients from your body. So that means that when you're losing your nutrients from the body, you are going to not to look as healthy as a normal person who keeps the nutrients in their body. Most of the people have what they call preanal diseases with fistulas. Fistula is just like another hole that creates itself because of too much pushing or too much constipation. When you're going to push, then you have a fistula that can occur there. And also there is such people have skin tags. Skin tags are some skin that protrudes outside, and those are what they call skin tags. So most of the people would have that. Usually your doctor will diagnose by taking your blood and sending it out. They usually would find that you have something they call microcytic anemia. So usually you're anemic, and you usually have low B12 vitamin, and that is why we encourage for you to take B12 vitamin. Take a lot of protein when you're eating. We also encourage you to give your stool so that they can check for blood occult if there's blood in the in the stool. Usually when they take your stool, there's positive blood in your stool because of the diarrhea. Some people actually are recommended, even if you're young, we recommend you do endoscopy or colonoscopy, even if you're young. Reason is most of the people who have this kind of disease are prone to cancers. So you might have cancer. So we need to check, do endoscopy, do colonoscopy to make sure that we keep, if there's anything in there, they keep, and make sure that you don't have the cancer. Other things you can do, those risk factors you can actually control, is like if you are a smoker, you need to stop smoking. If you are vulnerable like that, you need to take your immunization, your flu shots, you need to take them. You need to take foods that are high in protein. You also need to increase fiber in your food. you also need to, this is the only time I would say that you need to avoid raw fruits. Because of the diarrhea, your body is not able to hold it well, so you need to avoid fresh fruits. Also, check with your doctor, your gastro doctor, your doctor who deals with the colon and the GI doctor. Check your doctor. Make sure that you keep your appointments. Make sure that you are doing what you're told to do. Sometimes you can be treated with steroids, depending on what your doctor is going to give you. Just have this information and go to your doctor and ask. Do not start taking any medication without consulting your doctor. Thank you. Dr. Pam here. Share this video if it helps you. Share with your friends. If you have Crohn's disease, you need to be checked by your doctor. Share the video. Thank you. Be blessed. Dr. Pam.